I see this confusion almost every single week. Someone comes into the clinic thinking that they have a rotator cuff tear, or they've been told it's frozen shoulder, but they're doing the wrong exercises and actually they're getting worse. So these two conditions can actually seem really similar, but they're completely different problems. And if you're doing the exercises for one, but you actually have the other, it's going to make your problem worse. Hi, I'm Dr. Moss with Moss Rehabilitation Center. I've been treating patients with shoulder issues for over 28 years, and now I'm going to share my wisdom with you. So here's the key difference between our rotator cuff tears and frozen shoulder is with a rotator cuff tear, most people have problems with strength and pain. So the joint can still move on its own, but they just have difficulty trying to raise the arm, getting it up overhead as far as they would like, especially either rotating the arms out to the side or trying to reach overhead. Now, the frozen shoulder people or adhesive capsulitis, the problem is the motion itself. So the joint is physically locked. There's a barrier. The joint capsule has thickened and it's contracted and it's more of a mechanical barrier, and the arm just physically won't go up. So here's a simple test. Can someone take your arm and move your arm up and see how far it goes? If it only goes to a certain point and it's stuck and restricted, then more than likely it's a adhesive capsulitis frozen shoulder. If they can raise your arm all the way up overhead, but you can't raise it on your own, more than likely it's a rotator cuff tear. So that's just a very simple way to try to tell the difference between the two. So rotator cuff tears, more common in younger populations typically, and then if it's an acute injury like a throwing injury or a fall, but as you age, it's more of a degenerational type tear, especially with repetitive overhead work. Painters, people that do things overhead a lot, electricians that can do it, versus an acute fall or trauma that can cause and rupture the tendon very quickly. Pain is often worse at night, trying to lay on the side, and also you notice weakness when trying to raise the arm, and it's painful, and or reaching behind the back. With a frozen shoulder, this is more common in women, usually ages 40 to 60 range. There's a strong link to diabetes, almost 5 times higher if you're diabetic and if you have some thyroid issues. This typically develops after immobility. So think after surgery, even after an injury to the wrist and you're stuck in a sling, that's going to cause that shoulder to lock down and get really stiff with you. The frozen shoulder typically goes through 3 phases. A freezing phase, which the pain is very intense and your motion starts to decrease. Then the frozen stage, the pain is a little bit less severe, but the stiffness gets worse. And then finally in the thawing phase, it's gradual recovery. Still stiff, but that starts to get better and less pain. This can take up to 2 years to resolve on its own. Now, one of the most important things that I can tell you about having a frozen shoulder that tends to come on for no obvious reason is a lot of times it's not your fault. You did nothing wrong. It's just the body's starting to react with these certain conditions that are going on. If you're finding this video helpful, please make sure you like, share, and comment below. Also, don't forget to subscribe for future content. So how do we treat a rotator cuff versus a frozen shoulder? So frozen shoulder treatment. So early on, if you do aggressive stretching in that freezing stage, it often makes things worse. So in 28 years, I have seen this damage patients and actually cause them to set back quite a bit. So early on, we want gentle, use pain as a guide to use as a marker for your range of motion and your stretching. We don't want to be really aggressive with it, okay? Cortisone injections can also be very effective, and you can put some heat on the shoulder before you start to do the stretches. That'll tend to relieve some of the pain and help with the mobility. Patience. This condition tends to resolve on its own. However, the things we can do in therapy can kind of help coax that along. A rotator cuff treatment is going to be a little bit different. So here, it's progressive strengthening is the goal, not just pain relief. Scapular mobility. So in my other video, we talked about some of the foundational exercises for the scapula. Those are things that we work on with rotator cuff tears as well. Partial tears can often be managed without surgery and just proper progressive strengthening exercises. If you have what's called a full thickness tear, the rotator cuff is completely torn away from the bone and retracted. Surgical repair is often needed, only if you go in early enough. If you have a full thickness tear, a lot of times it's super painful, and then all of a sudden you realize you can't raise your arm, but the pain has resolved and go away, and most people just say, oh, it'll be better. If you wait too long, that muscle will actually pull back and retract, and the surgeon is not able to then reattach that torn rotator cuff. So if you do have a acute onset, say after a fall and very intense shoulder pain, and then you can't raise it, make sure you get in to see your orthopedic surgeon so they can properly evaluate that. I've also had patients that they've been told that they didn't need surgery when they actually did, and then I've had the reverse as well. So make sure you get your shoulder properly evaluated as soon as it starts to bother you. Now, if you're unsure what you're dealing with, then go in, see your favorite healthcare provider, your physical therapist, your orthopedic surgeon, so they can actually address your shoulder, your scapular mechanics, and see what is actually going on. Do you have an adhesive capsulitis frozen shoulder, or is it a rotator cuff? Don't rely on an MRI report alone. I've seen patients come in and they have very minimal changes on their MRI, and clinically they have a lot of limitations in their mobility and a lot of pain. And then I've had patients that have MRIs that look absolutely horrible and they have almost no shoulder pain and or symptoms. So the clinical exam is crucial in determining which condition you have and also what is the proper treatment path for you. So if you're having shoulder pain, please drop your comments below. I'll read every one. I'll respond as best I can to help you out. But hopefully you found this video helpful. We'll see you on the next one.